The health fair featured stalls from several departments in the Ministry of Health and non-governmental organizations such as Hand in Hand Ministries, who deals with TB and HIV patients, the Diabetes Association, PASMO, the Belize Dental Association, the National Drug Abuse Control Council, and the University of Belize. And while stalls were featuring information on topics like HIV/AIDS and drug abuse, the focus was to sensitize the public on tuberculosis. Dr. Francis Murray, who works with the Ministry of Health, assisted in organizing the event.
TB in Belize is said to be endemic. Okay, being a third world country, we have not been exempted from the wrath of tuberculosis like other countries in our region. But with the HIV epidemic, we've had certain increases. For example, in 2002, we had an increase. In 2004, we also had an increase of TB cases. In certain areas of our country, we have found out that because of active surveillance, that we are going out and asking and testing people who present symptoms that might be suggestive of TB. And yes, we've had I shouldn't say an increase, but a greater number of patients compared to the previous year.
Is this any reason for concern?
Tuberculosis should be a concern on a daily basis. Okay, it's not because we're celebrating TB Day that this activity is going on. I mean, we try to educate the communities on a whole. One of our nurses, or both of our nurses, and in Belize City at Chest Clinic, and also those in the districts, have educational activities in regards to TB, especially this week.
Dr. Morris says there is support available for Belizeans suffering from TB, but adds that the public should be more alert about the disease.
One, we have standardized national guidelines which have been actualized and disseminated to our medical officers and nurses. We have the Ministry of Health acquires medications free of cost on a yearly basis after having what we call a forecasting tool, projecting. Let's say if we had in 2009 we had 89 cases, we buy or acquire medications for at least 10 to 20 more patients that might be diagnosed within the next year. So our medical officers are being trained and retrained because, as we said before, sometimes since TB has been forgotten, some of our medical officers or nursing personnel may not think of TB as that it is endemic and common, but we are sensitizing them and educating them and saying, you know what, if someone has respiratory problems or has a cough that might be suggestive of TB, you can screen them for TB. And I think what we are doing presently is we have increased surveillance in all areas in the country, not only in Belize or any other particular district.
And, he points out, despite the stigma attached to TB, there is no need to discriminate TB patients.
You do not need to treat this individual badly or shun him or isolate him. Treat him as another person. Okay, if you have TB today, it is curable. We have the medications, we have the personnel out there who are ready to treat you and help, of course, and most of all, the medication is free, okay, and it's available.
Treatment is available at public health facilities in the districts across the country. Dalila Kal for Love News.